You wake up, swing your legs out of bed, stand up quickly, and suddenly the room spins. In a split second, gravity pulls blood downward, pooling it in your lower limbs. This internal drop equals suddenly losing 15% of your blood to hemorrhage. Clinicians call this orthostatic hypotension. If your body fails to push that fluid back up, you faint. Surviving this daily movement proves our cardiovascular system operates as a highly vigilant surveillance state, constantly adjusting to keep us upright. This diagram illustrates exactly what blood pressure is on a mechanical level. It is the lateral force exerted by a column of blood pushing outward against the walls of your arteries. That precise outward pressure is required to maintain the flow of blood, perfusing your tissues with oxygen while actively fighting the downward pull of gravity. Because gravity never stops, the body must deploy immediate, split-second biological countermeasures to keep the internal pressure high enough to sustain life. The first line of defense is the baroreceptor reflex. This is a neural safety net engineered to stabilize your system within 15 to 30 seconds of any posture change. As we can see in this schematic, high-pressure sensors are embedded directly into the walls of the aortic arch near your heart and the carotid sinus in your neck. When you stand up and blood volume drops, these sensors immediately detect the loss of stretch in the artery walls. They instantly fire alarm signals up the 9th and 10th cranial nerves, routing directly into the brainstem. These signals hit the vasomotor center in the medulla, the master control room for your circulatory system. The vasomotor center responds by rapidly throttling down your resting parasympathetic tone and immediately cranking up your fight-or-flight sympathetic nervous system. This instantaneous brain-to-organ reflex loop catches your falling blood pressure, stabilizing it before you can even finish walking across the bedroom. This equation shows exactly how that sympathetic stimulation works. Blood pressure equals cardiac output multiplied by peripheral resistance. To increase the cardiac output variable, sympathetic nerves force your heart muscle to beat faster and contract with more force. Simultaneously, the brain increases peripheral resistance by actively constricting the smooth muscle lining your arterioles. Squeezing those pipes multiplies against the cardiac output, forcing the overall blood pressure to rise. The body artificially restores pressure by simultaneously manipulating both the pump and the pipes. Early cardiovascular pioneers confirmed this physiological reality by meticulously measuring these rapid changes in the lab. But fast neural reflexes tire out over time. If a pressure drop is chronic, the body needs a long-term solution. Over a timeline of days and weeks, the kidneys serve as the ultimate arbiters of your blood pressure. When the kidneys detect sustained low pressure, they release an enzyme called renin. This kicks off a complex hormonal cascade known as the renin-angiotensin-aldosterone system. The end result of this chemical chain reaction is a direct command to the kidney tubules to stop excreting sodium and water into your urine. As this animation demonstrates, retaining that water physically increases the total volume of fluid circulating inside your vascular system, which actively drives up the baseline reading on the pressure gauge. While the brain squeezes the pipes for a quick fix, the kidneys permanently add more fluid to the closed loop to guarantee long-term stability. True physiological health relies on homeostasis, a perfect internal harmony between quick neural reflexes and slow kidney adaptations. We contrast this harmony with the modern epidemic of hypertension, where the regulatory system is chronically abused. Modern lifestyle stressors, like high salt diets, obesity, and chronic anxiety, continuously trigger these pathways, artificially forcing the kidneys to retain excess water. These choices turn an ancient survival mechanism into an internal weapon, leaving the arterial network dangerously overpressurized. The ultimate physiological danger of this chronic high blood pressure is what happens to the baroreceptors in your neck and chest. This dial shows how the neural sensors adapt. Over time, they actually reset. They interpret the new, dangerously high pressure as the safe, normal baseline and stop trying to lower it. This exact physiological resetting is why hypertension is dubbed a silent killer. It forces clinicians to rely on medical interventions to tell the system to stand down. Blood pressure is not a static number. It is a relentless, lifelong negotiation between your brain, your heart, and your kidneys to keep you standing.